Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accept it. Call Dr. Lederman at 212-CHOICES. 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super. In Manhattan at 38th and Broadway. Custom tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back, and we're back with practicing what we preach. So I talk about a gentleman, 60 years old. He has lung cancer. He had treatment elsewhere. It didn't work. He had chemo. It didn't work. He got fed up with it. He came to us. He had a stroke in the past, even during the chemo, and the doctors didn't even check to see if the stroke was caused by the cancer. Well, in fact, we got an MRI. Found the cancer spread to the brain. It was in the lung. Those two sites were treated, and now he's just finished cancer treatment to the adrenal gland. So remember a few minutes ago we talked about people who are aggressively treated for lung cancer and with an average survival of 5 years if you have metachronous cancer, not in the lymph nodes? Well, that's this man. So he had a lung cancer in the brain, lung cancer in the lung, and lung cancer in the adrenal. All three spots were treated. There's nothing left untreated. So just like I talked about, oligometastasis, all treated, finished treatment, no side effects. And with us, radiosurgery is a misnomer. It's not surgery. It's only using the radiation beam as if the surgeon were using a knife. Radiosurgery is non-invasive. There's no cutting, no bleeding. You come in, get a treatment, takes about 15 minutes, and go home or go to work. Usually there's no side effects. This man was treated for all three sites, the brain, the lung, and the adrenal. No side effects. If you look at him, healthy-looking man, doing great, fully functional. So he had his fifth treatment for the adrenal, which is it. He'll come back. He'll come back for a new follow-up scan. And our goal, of course, is to prove to him and prove to us and prove to you that radiosurgery worked. Our goal is to try to get him out years of survival, even though he has stage 4 cancer. We want him, of course, and he wants to be alive years from now. Has a great, loving family, very supportive, and is doing great. We have an interesting new patient who came in this week. A woman 73 years old with breast cancer. She had breast cancer. She had recurrence, actually. She had mastectomy and radiation years ago. And now comes in with terrible hip pain and terrible pain in her buttock and in her right groin. She was seen by a neurosurgeon. She was told she had a mass in the spine, and that neurosurgeon didn't want to operate on her. She heard about us and came to us. Well, she's 73. She had breast cancer. She has a mass in the spine. Obviously, the first concern is that cancer that is spread? So again, we practice what we preach. We staged her up, and we actually found that the mass in the spine isn't cancer. It actually was just a slipped disc causing tremendous pain. So number one, great news for her, that what she thought was cancer or a tumor in the spine is not. It's just disc. And number two, when we staged her up, we found an early ovarian cancer that she would have never found She didn't go to the gynecologist in quite some time. No one was even looking for ovarian cancer. We staged her up and found an ovarian mass, it seems, probably cancer. We'll tell you in the next week or so, that has not traveled. So, unfortunately, many women with ovarian cancer are diagnosed when the cancer's traveled. They get abdominal bloating, they have metastasis or ascites, which is fluid in the abdomen. This woman, because of the pain, came to us because the surgeon didn't want to operate for what he thought was a tumor in her spine. It turned out to be not a tumor, but a disc. We staged her up. We found what looks like a cancer in the ovary that has not traveled. So for her, this week was a productive week, good week. Everything was done quickly. And she was happy to make the trip to Radiosurgery New York. Some people say, can't you send me someplace else? Well, I would love to send you to someplace else. But you might want to think about, is it worth, for example, your life to make a trip to 38th and Broadway? This woman is so happy, I think she'll give you an answer that reflects how she feels about finding a cancer that otherwise wouldn't have been found by taking care of the spine, hopefully avoiding any surgery or radiation there, and be treated to live a long time. We had another man who came from Texas this week with a Merkel cell cancer of the face. This man had multiple surgeries on his face. He had standard radiation. He's had chemo. Didn't work. Came for radiosurgery. He's finishing up. The cancer's already shrinking up. In fact, his son, who lives in the New York area, and I had part of his treatment this past summer, and now he's finishing treatment. We were shocked to see how good he looks. I think probably 80% of the cancer is shrunken. We restaged him to make sure this Merkel cell, which is a kind of aggressive skin cancer, something like melanoma, that it didn't spread. In fact, the scans showed marked improvement compared to the summertime before he had any of his treatment. He's having his treatments in two parts, part in the summer, part now. So he's had marked improvement with no spread of his cancer. His son is really pleased. We're pleased. And I think the patient's pleased too. That's why he's here. In Texas, they said they didn't know how to treat him. And so he came back to finish up his treatments with us. He's been treated for Merkel cell cancer with a tremendous response, which is what we normally see for skin cancers. We also had another gentleman finish treatment this week that had 2 squamous cell cancers on his forehead and face, both treated. He had one tumor on the top of his head treated with surgery, and still the wound isn't healed from years ago. He had surgery and radiation and skin flaps. It didn't work. The skin is still hurt and damaged, whereas with us, the treatments, cancer's gone, cosmetically intact, he is happy, he is smiling, he is doing well, and he finished his treatment in a good way. And we have another patient this week, interesting woman. She works nearby. She organizes groups to go to religious sites worldwide. She's a black woman who smoked. She smoked about 60 pack years. She was in tremendous pain. I've never seen so much pain. She lost 40 pounds. She went to one of the big emergency rooms, one of the hospitals, and they just told her to go home. She's got nothing wrong with her. That was 6 months ago. Nothing wrong with her. Well, that pain, if the doctors are listening, and there's lots of doctors who listen to this show, that pain in her chest was cancer growing through the lungs into the ribs. Her breathing was short because the cancer had spread to the lymph node and was obstructing the lymph node in her chest. And it also spread to the adrenal gland. So it's exactly like the case and the study that we spoke about at the beginning of this hour, where studies show that patients with lung cancer with oligometastasis, 5 or less metastasis, can be treated and have average survivals of about 5 years if it's metachronous and not in the lymph nodes, and 5 or less. Well, average means half the people live less than 5 years, half the people live more than 5 years. So she wants to get out of pain, and most likely radiosurgery can shrink down that cancer and take the pain off the nerve. Right now she needs narcotics to relieve her pain and suffering. Radiosurgery can most likely shrink down the obstruction to the airway so her breathing is better. And the adrenal metastasis, the adrenal gland is the gland on top of the kidney, and many cancers go there. There's a blood supply that's vast. The adrenal glands make hormones, and many cancers, many lung cancers in particular, go to the adrenal gland. And yes, we have a high control rate, over 90%, in treating the adrenal gland with non-invasive stereotactic radiosurgery. So she's proceeding. She was in a hospital, in the emergency room. They didn't help her. She was in another hospital where she stayed for a week, and she hated it. She felt that they treated her disrespectfully. They didn't address her needs, her pain, her concerns. She was very angry about the hospital. She came to us just Friday, 2 days ago, and I said, "We're not the hospital." And she knows that already because I met her about 2 weeks ago. We got her staged, we got her biopsied, we got everything done. And she knows that we're different, that she can call me, she can call day or night, that we take care of her, we know who she is, we take her insurance, there's no secret bills. So she's on her way to be treated, and her first treatment will be tomorrow. We wish her well, and we wish her all the success, and we hope that her survival is years and years. And we have another woman who came in. This is a 53-year-old black woman on dialysis, which is interesting for a couple reasons. So she's trying to get a kidney transplant because she doesn't want to be on dialysis. And for the kidney transplant, the patient's body needs to be on immunosuppressant. So doctors need to suppress the immune system. And obviously, if you have a cancer and they suppress the immune system, that would allow the cancer to grow. So she was sent for mammograms, and the mammograms were abnormal. And again, she was at a hospital. She didn't like the runaround there. She heard about us, came to us, and we're getting all the answers for her straightened out. She wants to have a kidney transplant, be done with dialysis, and, of course, make sure that her breasts and these lumps are fine. And that's what we're doing. We're doing it quickly, immediately, without delay. And that's what she's happy about, that she has someone who cares for her, who wants to take good care of her and allow her to live a normal, healthy, long life. This is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center. We take care of cancer patients and brain tumors. Even if you've had chemo or radiation or surgery and it didn't work, or if you have a new lump. We have many women who come with a mass in the breast and it's sitting there, and of course the women are wishing it goes away, and it's not going away. It might be time to give us a call and get it taken care of, because most likely if it's a mass that's sitting in the breast or somewhere else, in your neck or in your arm or in your leg, it's probably not going to go away by itself. So we can easily diagnose it and quickly diagnose it. We take most insurances, Medicare, Medicaid. We even have something called the Urgent Cancer Consultants, where we promise to see you within 1 business day. And we're super convenient. We're located near almost all the buses, subways, trains, Grand Central Station, Penn Station, PATH trains, Port Authority, buses. So it's easy to get to us. We take insurances. We answer your questions. We don't have machines. We accept most insurances, Medicare, Medicaid. Our goal is to make you have the chance of a better, healthier, longer life. 212 choices, 212 choices, 212-246-4646. 4237. And here's our